Hello everyone, welcome back to the channel. This is the second part of the video. If you guys didn't watch the first video, it's high yield stuff that you will see on the shelf exam, and also you will be asked during your clinical rotations for family medicine shelf exam. So this is like part 2. The first video is very important. If you guys did not watch that, go back to that. I will put the link below. It's the USPSTF guidelines that you will definitely get multiple questions on your shelf exam. Right now, this video is going to be about other high yield topics that you will also get questions on your family medicine shelf exam, and also you will most likely get questioned and pimped on during your clinical rotation by your resident or attending. The first main topic would be COPD. COPD comes in 4 stages. So we have stage 1, stage 2, stage 3, stage 4. Mild, moderate, severe, very severe. So with mild COPD, we have 80% normal lung function. That's where basically the first treatment of choice would be albuterol, short-acting beta agonist. Stage 2 COPD, which is basically moderate, that's 50 to 80% lung function, and that's when we add a LABA. So we give albuterol plus a LABA, long-acting beta agonist such as salmeterol. I don't know if I'm pronouncing that right, don't judge me. Basically, albuterol, short-acting plus a LABA. Your third stage of COPD, that's when you have severe COPD, and that's 30 to 50% of normal lung function, and that's where you add the ICS, which is a intracorticosteroid, plus albuterol or SABA and LABA. Very severe, stage 4, that's when you have less than 30% normal lung function, and that's when you add oxygen to your treatment. So then you'll have like SABA, LABA, ICS, and oxygen. So other indications where you actually need to like give oxygen to a patient, because you also, that's a question I got during my clinical rotation where the attending asked me, so what do you think for this patient? Would we give this patient oxygen, send him home with oxygen or not? And I was like, I'm not sure, but I could look it up. So it was basically anytime you have saturation oxygen less than 88%, that's when you send the patient home with oxygen. That was it for COPD. Another high yield topic is high blood pressure. So the treatment of high blood pressure, if you have basically a patient coming in with high blood pressure, I got a lot of questions, and I've seen a lot of questions about basically what's the most indication that actually decreases our blood pressure. And it starts by weight loss being the most to actually lower our systolic blood pressure, and then it comes second place comes DASH diet, and then exercise, dietary sodium, alcohol intake. Those are the steps of like which one actually lowers our blood pressure, systolic blood pressure, from the most one to the least. So again, it's weight loss, DASH diet, exercise, dietary sodium, alcohol intake. Another high yield topic is gout. I had a lot of students telling me, please review gout, pseudo gout before you walk into the shelf exam, because you get questions about treatment. What do you do? What's the next step management? So for acute gout, when it's acute, the first line treatment would be an NSAID, such as indomethacin or colchicine. But if you, let's say you see a question and you have the 2 options, indomethacin and colchicine, always go with the indomethacin for acute gout. That's the first line treatment. And if for whatever reason this patient comes in with acute gout and they also have kidney problems, like let's say their GFR is low or something going on with their kidneys, don't use NSAIDs, just give them a steroid injection. So with chronic gout, before we give treatment, we actually have to measure the uric acid in the urine. So if the uric acid in the urine is low, then we know that it's a problem with excretion. So then we give propenicid. Whereas if basically the uric acid is like very high in the urine, then we want to prevent the formation of the uric acid, so we give alpurinol. That's the treatment for chronic gout. So now, anytime you have a hot, warm, erythema, lesion, joint, anything that has to, like in the question or in the vignette, describes a lesion being hot, warm, erythema, the next step, what we do is aspiration. So you should know that, definitely know that. Another high yield topic is pediatric milestone, and I know all of you guys probably hate this topic and it's so hard for you to memorize, and trust me, it was the same for me. So what I basically did is I open up my Anki, and I'm gonna get to like what resources in a different video to use and what actually helped me to kind of memorize and get a good grasp on all these stuff that I had to like actually memorize. So that's a subject for a different video. So for pediatric milestones, please know at least the most important things, such as like when do they actually roll, when do they walk, when do they use like pincer fingers, when do they social smile, when do they have stranger anxiety and all that. There's like actually Uworld did a good job. They have a tables that you can actually like try to memorize and maybe whiteboard that table multiple times. To me, Anki worked. So I'm just gonna mention briefly where like some random stuff about the pediatric milestones where I seen questions on these things. So when do they actually start rolling is 3 months. When do they start sitting up is 6 months. They start like walking 12 months. They use their pincer 9 months. So that's like, these are like kind of things that like I've seen that they ask questions on. But of course, you never know, they might, whatever question throw at you. So it's really good to like actually go through that table on Uworld and actually whiteboard it, do some Anki just to like actually know them, because for sure you are going to see some questions on pediatric milestones. Another high yield topic is basically normal fetal heart rate. You should know the normal fetal heart rate, which is basically 110 to 160 beats per minute. Anything higher than 160 beats per minute is considered tachycardic. And usually when do you see like a fetal heart rate more than 160 is usually when the mother is having a fever or an infection. So they might give you a question is like, we have a fetal heart rate of 180. What do you think is going on? Then in the options, you'll most likely choose like mother infection or a fever. You're also going to see a mother experiencing some fever, something around those words. Another high yield topic is otitis, otitis media with effusion, otitis externa. Know the treatment, know how they present. So otitis media is basically an infection of your middle ear, where like how they would describe it in the vignette, like a puffed out red erythematous eardrum. It's most likely caused by strep pneumonia, hib, varicella, and we usually treat that with amoxicillin. Remember that, and I'm going to repeat that. We treat otitis media with amoxicillin. Media with effusion is just basically your middle ear has fluid, and the presentation is usually bubbles inside the, like you'll see like some bubbles in the eardrum. And actually clinically, I've seen a lot of those. When you do an ear exam, you'll see like kind of like bubbles or like some fluid inside the middle ear. And that's usually just treated like supportively. Otitis externa, which is usually associated with trauma or swimming, and they might ask you what's the most likely cause of otitis externa, and it would be Pseudomonas. Another high yield topic is IBD. Please know the difference between Crohn's disease and ulcerative colitis. Where Crohn's disease, you're going to see it affects any portion of the GI tract. It is skip lesions. You'll see rectal sparing in Crohn's. You're going to see cobblestone, creeping fat, string sign. You're going to see a non-Cassian granuloma. Some complications are going to be strictures, fistulas, perianal disease, malabsorption. You could have bloody diarrhea or non-bloody diarrhea with Crohn's. The treatment of Crohn's is going to be corticosteroids, azathioprine. Again, sorry for the pronunciation. So the treatment for Crohn's is going to be corticosteroids, antibiotics, and there's multiple different ways, but mainly just focus on corticosteroids. Ulcerative colitis, you're going to see mesalamine. I'm not sure if I'm pronouncing that right, but mesalamine is for ulcerative colitis. Ulcerative colitis, usually it's a continuous colonic lesion, and it's always going to involve the rectum. It's mucosal and submucosal inflammation. Usually it is bloody diarrhea. You're going to see, it's usually associated with like ankylosing spondylitis, primary sclerosing cholangitis, uveitis, and it's usually, the treatment is mesalamine. Another high yield topic is IBS. IBS is anytime you see like an alteration between diarrhea, constipation. They would usually tell you in the vignette that basically the symptoms are relieved with defecation. If it's diarrhea, predominant, that's where like you could treat with loperamide. And if it's constipation predominant, that's when you can increase fiber intake. Another high yield topic is celiac. Celiac, the most vignettes would describe it as like a bulky, greasy stool. It usually happens in younger patients. The presentation is going to be diarrhea, a rash. That's another key word. You're going to have a rash with diarrhea, abdominal pain, weight loss, villus atrophy. It's a reaction to gluten. You're going to have anti-transglutaminase, anti-endomysial, anti-gliadin antibodies, and if you don't treat celiac, it could cause lymphoma. For your shelf exam, you should definitely know the different types of headaches, migraine versus cluster versus tension. So migraine is usually like the location is usually unilateral. Cluster, they would describe it as behind the eye. Tension is a band-like, so it's like around the head. Characteristics of migraine is usually pulsatile, throbbing, whereas cluster is like a sharp pain. Tension is like a tight, they would describe it as tight. And with migraine, you could definitely experience some photophobia. With cluster, you can have like sweating, nasal congestion. With tension, you can have like muscle tenderness in the head, neck, or shoulders. Another high yield topic you should know is croup. So what causes croup, which is the pathogenesis that for croup is parainfluenza viral infection of the larynx and the trachea. It's usually, you see it between in kids aged 6 months to 3 years, and it's usually in the winter. The way they would present is with a stridor, barking cough, hoarseness. The treatment for croup is basically corticosteroids, and if it's very severe, then you can actually give them racemic epinephrine. So the way we prevent croup is basically hand washing. Epiglottitis is another high yield topic, and it's usually caused from Hib. And the way we prevent epiglottitis and like Hib is immunization. On X-ray, you can find an enlarged epiglottis, and that's like a thumbprint sign. And the way it's presented is basically you'll find the fetus in a tripod position, drooling, high fever. Another high yield topic that's going to help you answer questions and know what's going on with the patient is the lung sounds. So we should know, the way I memorized it, so this table right here, the way I seen it, I would look at like basically the tactile fermentus. The only one that's increased is consolidation, which is usually like lobar pneumonia. And with percussion, I always have it memorized that hyperresonance is pneumothorax. And just knowing that alone, I was able to answer like a lot of questions. So just look at the table and see which one is different from the rest, and just like kind of like memorize it that way. Vaccines, the vaccines you should know is basically, they ask a lot about like HIV patients and what vaccines should we give when they are infected with HIV. So vaccines for adult patients with HIV infection usually is like HAV, HBV, those are usually like give to all patients affected with HIV if they do not document any immunity to hepatitis A, hepatitis B. HPV should be given to all patients age 11 to 26. Influenza, that's given annually. Meningococcus, that's given to all patients aged 11 to 18, or like to patients like that live in large group living, such as college students, members of the military service, or if they have any sort of asplenia or complement deficiency, you give them the meningococcus vaccine. Tetanus, the Tdap vaccine is given every 10 years, and the Tdap should be given in every pregnancy. Do not give live vaccines like MMR or varicella to pregnant patients, and do not give them, they're contraindicated to HIV patients with CD4 less than 200. The last high yield topic that I am going to repeat and repeat, this I would highly recommend that you guys go over this topic, because you are going to see a lot of questions on your shelf exams. And you will also get a lot of questions from your residents, your attendings, asking you about MSK stuff. So what I would recommend is basically just having a quick review about the like some anatomy, like of the shoulder, of the hip, of the ankle, of the knee, just like general anatomy review. And I would go through like the different fractures that you could have, different pathology that you can have. Just like naming the most common that I've seen are, for instance, like plantar fasciitis, which is basically, it's when you're experiencing some pain at the plantar aspect of your heel, and it's usually worst after prolonged rest. So in the vignette, they would tell you like a patient is experiencing some crucial pain when they first woke up in the plantar aspect of the heel. Basically, after like dorsiflexing the foot, that exacerbated the pain. So you would know that's plantar fasciitis. Some risk factors for plantar fasciitis would be obesity, flat feet, which is pes planus. And if you work a lot and exercise a lot on hard surfaces, the way we treat this, so in the vignette, they can describe plantar fasciitis and then ask you what's the next best management. And it would definitely be heel pads or like activity modification, stretching exercises. Another high yield stuff that I always seen questions on is Achilles tendinopathy, which is basically when you have swelling and pain at the posterior of the heel. And usually like there's a tendon rupture, so you hear like a popping sound and it's like a popping sensation. The way we diagnose that is basically we do an ultrasound and MRI. And like the risk factors for Achilles tendinopathy is athletic activities and like when some medications causes Achilles tendinopathy, such as glucocorticoids, fluoroquinolones. The management of Achilles tendinopathy is if it's acute, you do NSAIDs, you ice it. If it's chronic, you can do eccentric resistance exercises. All these are from Uworld. There's definitely a lot of good tables that you should go through before taking your shelf exam. Another high yield thing in MSK is to know when you actually need to do an x-ray. So I got a patient and they came in for an ankle injury. And then like after I presented it to my preceptor, and told them why the patient came in, she told me, okay, what do you want to do next for this patient? And I was like, should we actually like do an x-ray? She was like, do you know what the Ottawa rules are? And I was like, no, I'm not familiar with that. So I actually searched that and read about it. And noticed that a lot of questions come about the Ottawa rule, where like it tells you when you actually require an x-ray for an ankle or foot injury. And just like to mention them briefly, but definitely look at that in your spare time, is the Ottawa ankle rule is like you would require an x-ray if you have pain or tenderness in the posterior lateral malleus or the posterior medial malleus or in the navicular or in the base of the fifth metatarsal. That's when you would require an x-ray. Or if the patient is unable to take 4 steps, that's when we actually require to do an x-ray. So please know those, please review your MSK. We got a lot of questions about MSK and a lot of questions about arthritis, osteoarthritis versus rheumatoid arthritis, treatment, presentation. We got some questions about gonococcal arthritis, SLE arthritis. So please know all these information and you would definitely honor family medicine shelf exam. If you have any questions for me, please reach out, comment below, message me, and I'll definitely get back to you. Thank you so much. Best of luck. Keep going through this and you'll kill it.